Good morning, everyone. Almost the lunch hour, so thank you so much for joining me today. I'm Lauren Clark, and I'm excited to share this project with you. During my practicum, I had the fortunate opportunity to learn and contribute to the development of the Teach Food First evaluation proposal with Island Health's Community Health and Nutrition Services. I would like to acknowledge with respect and humility that I'm joining you today as an uninvited settler, gratefully living and working on the unceded traditional territories of the Comox First Nation, also known as the Comox Valley on Vancouver Island. I recognize the ongoing settler practices of dispossession and colonialism and commit to continued learning and practice of culturally safe service. To help situate this presentation topic, in 2019, Health Canada released the latest version of Canada's Food Guide after a systematic revision process. Soon after its release, BC public health dietitians from regional health authorities came together to form the Food and Nutrition Resources for Educators group. A key priority for this group was to provide support to BC educators with the consistent implementation of Canada's Food Guide in the school setting, utilizing a coordinated, collaborative, and equity-oriented approach. Many stakeholders, including the BC Ministry of Health, BC Centre for Disease Control, First Nations Health Authority, as well as Indigenous knowledge keepers, Indigenous food consultants, and education consultants, in partnership with the FNRE group, collaborated to develop a centralized, easily accessible knowledge translation tool for educators. The purpose for creating this toolkit in the form of a website was to help connect the revised food guide with the BC Health curriculum for kindergarten to grade 8 teachers. Although Canada's Food Guide provides dietary guidance for the general public, the collaborative team believed it was important that educators have additional supports and resources to guide food and nutrition literacy within the school environment, which specifically considers BC's culture and curriculum context. This initiative was launched in the fall of 2021, and it was developed to include resources, tips, and classroom-ready lessons for educators. It explains the guiding principles for best practice approaches to food exploration and nutrition education, which include taking a positive and inclusive approach to food and eating, to consider the roles that adults and children have in eating and feeding, and to connect food to students' lived experiences. It addresses frequently asked questions that help to explain some of the changes in the 2019 Food Guide, and it explains the many complex factors that influence food choices, particularly with children and youth, such as taste, preference, cost, culture and celebrations, or food choice in relation to what the child may be provided with or have access to in their home or environment. It also includes a foundational knowledge resource called Setting the Table, which was created by Indigenous food and nutrition consultants and knowledge keepers to provide context to inform and accompany Indigenous lessons. This document discusses traditional foods and culture and the impacts of colonization on Indigenous food systems. Teach Food First also addresses dichotomous messaging about food, as categorizing food as healthy or unhealthy can potentially lead to confusion, anxiety, and pressure, or may reinforce harmful restrictive dietary behaviors. Throughout the development phase of Teach Food First, the FNRE group was planning for an evaluation once the toolkit had launched. This evaluation plan would allow for concurrent assessment regarding delivery, applicability, and quality, while Teach Food First is utilized by educators. The main objectives of this evaluation are to maintain a living toolkit that can reach and support BC educators with providing food exploration and nutrition education to K-8 students, and to determine if Teach Food First is effective at connecting the 2019 Food Guide and best practice approaches to the BC curriculum. The evaluation strategy included determining short-term and intermediate outcomes of interest, evaluation questions, corresponding indicators, and data collection design. I was involved in creating the evaluation framework, including developing a logic model which provided a descriptive illustration of inputs, activities, and outputs and their relational links to Teach Food First's development, short-term and intermediate outcomes, and evaluation design strategy. Many concepts were identified by the evaluation team, which you can see listed in the middle of this slide. However, the overall plan was to consider its usability and identify key areas that we want to receive feedback about, such as educator understanding and confidence with teaching food exploration and nutrition, its adaptability for diverse school populations, student engagement, and if there are any barriers for use or unintended consequences. As a result, the corresponding indicators identified are measuring whether Teach Food First is being implemented and utilized as intended, and measuring whether it's achieving the anticipated or desired effects. It was determined that a mixed method cross-sectional survey would be the best approach for the evaluation, and it's in its final phase of development by the evaluation team. It includes both open and close-ended questions to allow for efficiency with survey responses, yet some opportunities for greater depth to inquiry for key areas of evaluation interest. Website metric data collection is also included in the evaluation. However, this information is aggregated, which means we can't differentiate the user or whether the resources are utilized after they are downloaded. The evaluation team is mindful of the impact that COVID-19 has had on educators. We want to ensure that we provide enough time for educators to review, understand, and ideally integrate best practice approaches and utilize the Teach Food First resources and lessons so that the evaluation feedback is successful in its effort to gather this important feedback. Participant recruitment hasn't been fully determined. However, the survey will likely be disseminated based on a non-random convenient sampling design, as voluntary participants will be included if they indicate they are familiar with or have utilized Teach Food First. Incentives are also being considered. The tentative plan is to administer this survey either late spring or in the fall of 2022. So some of the strengths of this evaluation proposal include that it aims to obtain early feedback to facilitate timely improvements or modifications in order to maintain and enhance educator usage. Its survey approach also has the ability to provide a comprehensive assessment of the toolkit by attaining both quantitative and qualitative responses. It's mindful of educator capacity and has a flexible timeline and the diverse expertise, perspectives, and time of the collaborative evaluation team. The challenges of this evaluation include that the data collected will capture a single moment in time, which may limit the number of participants. And the convenient sampling strategy is non-random and voluntary, which has its limitations. For example, it may not capture why educators might be aware of the resource, but have reasons for not using it. Additionally, focus groups or in-depth interviews are not possible in this particular evaluation phase, given funding, time, and capacity constraints. Teach Food First was developed to support educators and build capacity to increase promotional efforts enhancing student reach. Any improvements and modifications identified by this evaluation will not only help to optimize Teach Food First, but also help to guide future provincial educational supports and/or policy development in other areas of school health, including physical, social, and mental health literacy. It may also guide school health initiatives or evaluation in other provinces. In conclusion, providing educators with useful evidence-based tools to guide best practice food and nutrition approaches may enhance and increase food and nutrition literacy opportunities in schools, as well as enrich social and cultural food connections and understanding. This may lead to improving the overall health and well-being of students and educators. Thank you so much for listening today. I would like to also acknowledge and thank my Island Health practicum supervisors, the Teach Food First evaluation team members, and the faculty, staff, and colleagues at UVic who have supported this MPH learning journey. I have time for a few questions or comments.